Good afternoon. My name is Tim Markle. I'm the director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. We're out of the Waisman Center in Madison, Wisconsin. Southern Regional Center covers 14 counties in southern and southwest Wisconsin. We provide information, referrals, support, and assistance to families of children with special healthcare needs and the providers who support them. This is Conversations on Showing Up for Kids, where we talk about topics that hopefully are relevant to families and providers in the area of special healthcare needs. Just a disclaimer, I am not a medical professional. I'm not an educational professional. I am not a lawyer. I talk, and I talk to people. All we're doing is we're having a conversation. Please do not take this as legal or medical advice. Thank you so much for joining us. I am excited today. Some days I have people that I've known for a while, and we have this really conversation, and then other times I get to meet new friends and I get to meet new people, and I'm really excited about today because I have new people that I've gotten the chance to get to know over the last couple of weeks as we've been planning about what we're going to say, and I'm just really interested to have this conversation. So I'd like to take a moment and have them introduce yourselves and then themselves, and then we'll go ahead and we'll get started. Holly, why don't you go ahead and introduce yourself?
Hi, my name is Holly O'Higgins. I'm the Universal Service Fund Director for the state of Wisconsin. I work at the Public Service Commission of Wisconsin.
Holly and Billy?
Hi there, good afternoon. First of all, thank you, Tim, for allowing us to join in this conversation, this podcast, or however you call it. I appreciate that. My name is Billy Malden. I am the TRS and TEPP administrator for the Universal Service Fund, or work for the Public Service Commission of Wisconsin, rather. TRS is Telecommunications Relay System, and TEPP is the Telecommunications Equipment Purchase Program. I am deaf, so I will be using a female interpreter to voice for me for today.
Thank you, Billy, and we will get into more of what acronyms mean a little bit later so that you can educate me on what all the acronyms are. And then we also have Becca joining us. Becca?
Hey everyone, my name is Becca and I am the program coordinator at the Well Badger Resource Center.
All right, so that's who we're going to be talking to. I want to start off with Holly and Billy. So you guys mentioned a couple of programs like Lifeline and Universal this and Public Service that and TEPPs. And can you just take a few moments and just tell us a little bit about the programs that you're connected with?
So I can get started. The Universal Service Fund is a program that focuses on accessibility to telecommunications for people with disabilities, people with high cost, and also for folks who are low income. So the Universal Service Fund has a number of different programs, one of which is the Lifeline program that I'll talk about today, and one of which is Billy's. And that's the TEPP program. I didn't know if you're going to jump in.
Well, I wasn't sure if Holly, you wanted to explain a little bit about Lifeline first. I don't mind talking about the TEPP at this point, or how would you like to proceed? I'm flexible either way. Tim?
Oh yeah,
you start with access to telecommunication. That's kind of the overarching piece of this, I think, right?
That'd be great. Let's put it all in context, Holly.
Okay. So I'm going to talk first about the Lifeline program because that's the one that has a direct impact for folks. So Lifeline is a federal and state program that pays phone companies to discount the phone bills of eligible and enrolled customers. So in Wisconsin, the goal of this program is to bring the cost of the monthly phone bill that you pay down to $15 a month through a combination of federal and state payments to phone companies. So sometimes the phone bills can be higher than $15, but in the program, the customers who are eligible and enrolled are called subscribers, and we talk about phone companies as carriers or providers. Just thought it would be important to put that lingo out there right away so that you know. Did you have a question, Tim?
No, no, and then I'm going to ask a question. I love it when I do that. Yeah, so I'm always curious about these sort of programs. So you have the subscriber who's paying a set amount, but you have a carrier that normally charges a certain amount. Is the federal
Right.
state partnership then making up that difference? Or is there like a contracted set fee that by the carrier being in the program, they agree to, I'm from the healthcare system. And so,
Right, right.
I know with insurance, there's like, well, there's the fee that everybody would pay if they walk in the door. And then there's a negotiated fee if you're within the health plan. So is there like this negotiated fee that the carriers are then charging less, or is it making up the difference?
So it's kind of a make up the difference thing if we want to look at the categories that you suggested, right? So the idea is that your phone bill is reduced to $15. Now that $15 price can be achieved through the combination of the state and federal discounts. So the federal discount depends upon the technology. If you're a voice only provider, you can get $7.25 or 25 cents per person, but on December 1st of this year, that'll drop to $5.25. If you're providing broadband or bundled services, you can earn up to $9.25 per person if you're able to meet the speed requirements. And without getting too far in the weeds, that's really the high view perspective, right? So in Wisconsin, what we do first is we define in our in our state administrative code what the base rate is. So as a phone company, here's my base rate. It includes all these features. Here are the things that make up my base rate. And then there's rules about if it's less than $25 or more than, most or more than. So once you have that base rate, you subtract off the federal reimbursement that you get from the federal Lifeline program, which is either $9.25 or $7.25 right now. And then you look at what's left. And then we say, what can we subtract from this to get to $15? So every provider has a different reimbursement rate depending on what they charge. Some of the providers are rural companies that are operating in northern Wisconsin, for example. Some are statewide companies that are providing mobile phone service, for example. So really the kind of cost that they have and how they charge their customers varies depending on the company. And it's important to note that these are private companies. And in Wisconsin, telecommunications is deregulated. So we can't control any of their rates. That becomes important because sometimes a company can get the $9.25 from the feds and $9.25, which is our maximum reimbursement rate in Wisconsin, and you'll still have a phone bill that's more than $15. That's out of our control. But what we really try to do is get it as close to $15 as we can for families. There is a bunch of other stuff I could talk about with this. Do you want me to just plow ahead for a little bit?
Plow ahead, especially looking sort of at the
Okay.
the difference between, are you talking just landline, or it sounds like you're talking wireless as well?
It's all of it. So the thing is, there's a whole bunch of different services, and I had, there's you can have voice only service, you can have broadband service, which is broadband only. You can have bundled voice service. You can have bundled voice and broadband. The thing is that every provider offers something different. So while the Lifeline discount can be applied to any of these services, you have to work within what your provider offers. And then also you have to work with a provider who's authorized by the state of Wisconsin. So that authorization, the technical name is an ETC, or eligible telecommunications carrier. Not all phone companies in Wisconsin are ETCs. And so there's a list on our website of who is and who isn't. Now, before I would get too far into that, though, I'd want to back up because there's two different parts to the program. First, there's eligibility, and then there's enrollment. On the eligibility side of things, people who are eligible are, I'm going to use the exact words so that I can make sure that it's clear, that it's a customer can be one or more of the customer's dependents, or the customer's household, or the customer themselves must receive benefits through one of the following programs: Medicaid, SSI, food share, veterans and survivor pension benefits, federal public assistance housing, known as Section 8. So if you receive any of these benefits, you're eligible for the Lifeline program. And just a cautionary note, I said Medicaid, but in Wisconsin, there's a whole bunch of flavors of Medicaid. So if you receive, if you're on the Medicaid purchase plan, or if you're receiving Badger Care Plus, you're not necessarily already in the means tested portions of those programs. So if you are, for example, receiving Badger Care Plus, yet you have an income that's more than 135% of the federal poverty guidelines, you will not be eligible. But if you're on straight Medicaid without like the Wisconsin variations, you would be eligible. So it gets a little bit in the weeds, but I think the important piece is for this, that it's not just the program participation that can qualify you for Lifeline. You can also be qualified for Lifeline if you have an income that is at or below 135% of the federal poverty guidelines. So how would you know if you're eligible for the program, right? But before I talk about that, just a quick note, there are other programs for people living on tribal lands that qualify them as well. So I just want to make sure that that is an important notification for people who live on tribal land here in Wisconsin. So you have all those programs, plus folks on tribal land can get, if they're receiving the Bureau of Indian Affairs General Assistance, the tribally administered temporary assistance for needy families, or known as TANF, Head Start for families if they meet the income qualifications, or the food distribution program. So there are specific carve-outs for folks on tribal property. I want to make sure we draw attention to that. So if you're wondering, am I eligible? Then you get to go online and start the first step of a two-step process, which is eligibility. In Wisconsin, we're connected to a national database called the National Verifier. So it used to be that eligibility was determined if you were a customer by calling a phone company in Wisconsin, giving them a bunch of information. They would connect to Wisconsin databases and looking to see if you're eligible or not. We no longer have that system in Wisconsin. Instead, we have the National Verifier. And the National Verifier is connected on the back end to the Wisconsin Health Services databases for participation in the programs I listed. And we're also connected to the Wisconsin Department of Revenue databases to look at those income qualifications. So when you're looking as a customer on the front end, the folks at Healthy Badger, the folks at the independent living centers can help you. You can get a lot of assistance to sit down on the computer after you go to the website, which is checklifeline.org, one word, and you put in a bunch of information, and you have to consent to having your information checked against these government databases that I mentioned. So it'll check the state databases, it'll check the federal database for Section 8 housing and veterans benefits, and in Wisconsin, it'll also check our revenue database. So I think that this is an important piece of the puzzle, that folks who are doing information and assistance and benefits counseling can really help folks walk through this process, because it can be a little bit confusing. And there are a series of consents that have to happen from the person who is applying. So that's an important note, right? So if you don't have access to the internet, also you can do this on paper. Now I can get more into the National Verifier piece unless you want to take a quick break and go in a different direction for a little bit.
Let's take a little breather from the National Verifier.
I know it's a lot of information.
That's a lot of information. And I'm thinking of a question based on our population. Is you're talking about eligibility through Medicaid. And we know that a lot of our parents with children with special health care needs become eligible for Medicaid through the Katie Beckett program, which is based upon the child's disability and level of need and functional screening and care needs versus the income. And so someone who is on Medicaid, but they came through Medicaid through Katie Beckett, that will not make them out, they still need to go through, everybody needs to go through national verification. But there's a chance that they're not going to be eligible for the program depending on their income.
Right. Right. Every flavor of Medicaid in Wisconsin has different income qualifications. If it's Katie Beckett, or if it's the Medicaid purchase plan, or if it's any of these other Medicaid associated programs in Wisconsin, they don't all have the same income qualifications. And that really becomes the bottom line.
Okay, so it all has to do with that eligibility requirement. And would you say the first step to determining eligibility is the national?
Frozen.
I know, I just noticed. Am I back?
Yes, the first step is always the national verifier. You're back. And there's a lot of assistance out there to help with the national verifier. So you could, like I said, you can work with advocates or benefit specialists. I'm sure you can work with the folks that Becca represents and talks about. And so it's just a matter of, making sure that you get the accurate information to put into the system and that you consent to the fact that your information is shared. Because when a customer goes on the national verifier, they're going to ask for 4 pieces of information that are personally identifiable. They're going to ask for the birth date. They're going to ask for your full name. They'll want the last 4 digits of your social security number, and they want your street address. Because remember how I said it's a federal and state program? So Wisconsin is aligned with the federal government on many of the rules. And one of the most important rules is that it's limited to 1 subscription per household. So if there is a child in the family who receives SSI, that person can qualify the entire household.
That's good. It's
That's
good to know.
important.
Yep, that's good to know that it seems like once somebody in that household is able to be eligible, then that household is eligible and will be able to receive.
Right. It is known as a federal low-income program, which is why it always comes back to that 135% of the federal poverty guidelines.
Cool. And do you have on your website where we're at with the federal poverty level guidelines? Do you have a cute little chart that keeps updating each year?
Yes, I do. I have a link, so I don't have to update it every year because I
Ah.
know that DHS does it, and we just connect to them.
Very good. Because I'm always fascinated to see over the years how close I've been under or over, depending on which portion of my story you decide to enter
Right.
into. Which decade of my life sometimes depends on which part of that level that I fall on. As with a lot of us, it's
Well, and I think that the point you
fine.
make is really relevant when we are asking ourselves, do we think that we're eligible or not, and not knowing where we might fall along those federal poverty guidelines. I think it's always important to kind of just check in and see. I mean, the national verifier doesn't cost you anything to participate in, and if you do get an eligibility determination from the national verifier, then you can enroll in the Lifeline program and take advantage of the discount. In fact, with COVID-19, what we've seen from the Federal Communications Commission is an extension of some of the documentation that's appropriate for the low-income verification. So if you remember, I talked about how we connect with the National Verifier with the Wisconsin Department of Revenue data that really relies upon 3 months of income information. That's the standard approach that they take. Now that we're in the COVID time and folks are losing their jobs and there's a really specific economic impact, there is a little bit of a difference in the accepted documentation for low income. So when you're in the National Verifier, you can either upload a accepted unemployment application, or you can upload, let me find the exact name for it. I'm sorry, I just have to take a second here. I want to make sure that I get it right here. So what it is that until November 30th, that's right now, that's where the FCC has extended it to, but until November 30th, people who are income qualified may provide a notice of unemployment benefit payments or a notice of a successfully submitted application for unemployment benefits as long as it's dated within the last 3 months. So this documentation, like I said, can be uploaded to the National Verifier, or if you're filing a paper application, you can just include that with your application. And so this is intended to kind of get at these short-term losses of income so folks can really take advantage of the Lifeline program.
And so once someone's deemed eligible, is this then something that they're going to have to re-up every month? Is it good for 3 months? Is it good 6 months, a year? Or when do they have to redo it?
So once you get an eligibility determination from the National Verifier, that information will be saved for 90 days in the system. However, once you enroll in the program, then you are part of the recertification and your anniversary date every year. Right now, the anniversary date recertification is on hold, according to the FCC, along with the same kind of guidelines that allowed us to do the different kinds of documentation for the low-income folks. So what they're trying to do is really make sure that folks can continue to stay on the program even past recertification. So that kind of is more in the nitty-gritty weeds of the program, but that makes sure that people have service for at least 12 months and then they re-up it every 12 months. So that's how that works. And of course, there's a requirement that you agree to in the process that you say that if your income, triples, you get a great movie deal, that you voluntarily de-enroll from the program, right?
I mean,
So
my
there's also
movie
that.
deal is, I think it's about 3 weeks away. I think I'm
Yeah,
within
well,
that 3-week window of having that movie deal. That's what I'm hoping. That's what my people tell me.
okay, so that's some good news for you. I'm glad to hear that, Tim.
Yes, I'm going to take out a third mortgage on the basis of that news.
Right.
Oh, I wish. I've been slowly updating the electrical in my house as I can afford to. That's the way it
That's not an
goes.
inexpensive choice.
Correct. So little by
So
little.
let me just tell you really quick about the enrollment, and then I'm going to step back and so we can talk a little bit about TEPP.
Okay.
So after you're eligible, it's not going to mean anything or do you any good if you don't enroll in the program. Okay. So do you remember how I said it used to be handled, the eligibility piece, by phone companies in Wisconsin? It no longer is, right? The part about enrollment is still handled by the phone companies. So the carriers it's their responsibility under the rules to make sure that you get enrolled in the program. They can't do it without a determination from the national verifier, though. So you can see how these two things are very closely linked. So get enrolled in the program, you have to first contact an authorized phone company. So that might be the phone company you already have, or it might not. So one of the things that folks don't necessarily always get excited about is the fact that in order to take advantage and enroll in the Lifeline program, you might have to change your phone company. So there's a list on the commission website that shows all the different eligible telecommunications carriers who can participate in the program. You can check that list and kind of figure out, is your current phone company on it? Are they not? If they're not, who do you want to switch to? So those are the folks that are serving Wisconsin. There is a little caveat here, which is if your current phone company that you like doesn't provide it, and you do have to change phone companies in order to take advantage of the discount, I can't recommend anybody because that's not, that's something we're allowed to do as state employees. But I can let you know in advance that this will require some legwork on your behalf. So the customer is going to have to call around and find out, which phone company they really want to work with. If the prices might be comparable, but there may be different kinds of services available. There's all of these kind of, pieces that you use to make your decisions when you're looking for a different phone service with or without the Lifeline discount. So that's going to be a little bit of legwork. And there may be folks on those advocacy organizations that might be willing to help you with that process. But that's kind of that's a little bit of a sticker, but it is what it is. Now, there used to be a process by which you got a free phone, and they called them Obama phones or government phones. And this is still something I get contacted about quite a bit. I would just like to note here that there is no requirement for any private company to provide a phone to you. So that is something where you have to do a little bit of legwork and call those mobile phone companies and see, hey, if I enroll in Lifeline, will you send me a free phone? Those are the kinds of the questions that folks are going to have to ask. So I just wanted to note that as well.
So Holly, are you allowed to put together like things you would ask the phone company questions for consumers, or is that something that we could work with together? Because I think that'd be really important, because if people don't know the questions to ask, they're not going to ask the right questions. We don't know the right questions until someone helps us ask them.
Right. And, a lot of it depends upon your personal preference when you're looking for a phone company, but there are some basic ones that you may want to add with regard to Lifeline that I could help you put together a set of questions.
Okay, why don't we work on that? And then are you able to come back with us October 22nd?
Yes, I am.
All right, well then maybe we'll have something new. Well, Lifeline to
Maybe.
talk about on October
That sounds like
22nd.
lightning speed for the glacial pace of government, but I think it'll be just
Yes, it does. We're not saying that it's going to be out of draft form. It will still
right,
be
right,
draft form, not able for public consumption. But
right.
it's something that I think that'd be really good. We
Well,
found a lot of success with various programs, like when we were working with families who were trying to access mental health coverage, is to provide them with a series of questions that they want to ask that mental health
mhm,
provider, starting with what insurance do you take?
right,
What's your
right.
copay? What's your cancellation policy? What's your mercy on your cancellation policy? Um, so I think maybe if we could just get a short, things you might want to consider asking. I
Sure.
think that would be helpful.
That sounds like a great idea. I'll work with our folks in consumer affairs to help pull something like that together.
I love giving other people work, Holly. I really do appreciate
Oh, so much fun.
it. All
Well,
right.
now
Well,
I'm going to step back and we could talk about TEPP.
so we do. We want to make sure that we don't extend too long into 45 minutes or so. But I feel really horrible having Billy and Becca sit here and watch us. So yes, let's go in a little bit. Becca's like, I don't need to talk. It's okay. But Billy, can you give us so how about a teaser? You'll come back October 22nd. We're going to devote a lot of the time on October 22nd to the TEPP program. But I guess one of the things I want to make sure people are clear about before we even get into it is eligibility. We have Lifeline, which is based entirely on income, and you have a national verification. So what is the TEPP, and what sort of people would be interested in a TEPP program?
Oh, wonderful. This is Billy again. You stole it. Yeah, this is great. I did want to keep it short and also give Becca a little bit of time if possible. I can go into a lot more detail on October 22nd, but just to give this in a nutshell for you, the purposes of the TEPP program are to provide specialized equipment to Wisconsinites that have disabilities and allowing them access to basic telecommunications services. That said, there is no income restrictions to qualify, and I can go into that later, but anyone can earn, $5 to $1 million can participate in the program and qualify for our specialized equipment. It's dependent on your disability.
So as a teaser,
We provide,
sorry.
oh, I'm sorry, you can go ahead, Tim.
Oh, okay. No, I was going to say just sort of as a teaser for our next one, give us an example of what is a piece. I mean, a lot of us who are not hearing impaired, we would have no idea what some of this equipment is that you're talking about. So can you give us like an example of what sort of equipment do you help provide? And we'll get into more of the details, like if there's a top one, like everybody gets this, or everybody wants this. What are we talking about?
Yeah, I was going to actually have that. I have that on my list. I was going to hold that for the 22nd, but the disabilities I'm referring to are various categories of hard of hearing, deaf, deaf-blind, deaf-low vision, speech disabled, and consumers with limited mobility. So we have those 6 disability categories that you can find yourself eligible through. With the person that has a disability, they are self-identifying and choosing which category they fit with the best. So it's very a self-empowered program based on their individual needs and preferences and identification. It's a voucher program, so each disability category has a set dollar amount. So when the consumer receives their voucher, then they can redeem their voucher to purchase their specialized telecommunications equipment from authorized vendors, which can be found within our program. So I think I'm going to leave it at that. I mean, we have 5 minutes left, so.
Yes. So when we come back on the 22nd, we'll get into a little bit more about then. Sounds like eligibility is going to be based on the ability or disability. And then from there, there's the enrollment, and then the equipment is possibly dependent upon then the category. So
That is correct. Yep,
thank
and
you.
I will
So
go into all of that.
Whew. All right, then we'll get into that in 20 seconds. So before we close out, one of the thoughts that I had as I was talking to Holly and Billy early on is that a lot of people that would be eligible, possibly eligible, or thinking about eligibility for Lifeline or TEPP, most likely have very complicated lives. And they may need support beyond telecommunications support. And not a lot of people know that there is information and referral services out there to help them with that. Favorite place that I use with my work with children and youth with special health care needs is a program called the Well Badger Resource Center. And so a little bit today, we're going to explain what Well Badger is, and then hopefully on the 22nd, Becca can be back with us, and we can explore a little bit more about the complicated lives that if you're part of these programs, you might find other information about other programs also very valuable. They can find that information out from Badger. First, could you just give us an overview, Becca, about Well Badger and the number of programs underneath your umbrella?
Absolutely. Thank you, Tim. Yep. So Well Badger, we are a health information and referral service. We help individuals, families, and health professionals who might be calling on behalf of patients or clients, say, connect people to resources statewide and local to help them whatever their needs are, whatever they're looking for. If someone gives us a call, let's say they're looking for financial assistance, we'll conduct some eligibility screening, and we'll figure out which areas we might be able to secure some resources for them that might be able to help. Are they looking for food assistance? Are they looking for supplies for their children? Are they looking for respite care maybe? And exactly in this situation here, are we looking for telecommunication assistance? You know, we're not living single struggle lives here. And so usually if someone calls in, you know, specifically, let's say financial assistance, they might be calling for food share, but what that sounds like to me is that maybe we need to perform a little bit more additional screening. What else can we help you get connected with? So that's kind of what our role over here is in a nutshell too. Just helping folks get connected to anything to help support their lives and their families.
And again, lots to unpack in that statement, Becca. So I appreciate you hanging in today and coming back on the 22nd. I am going to go ahead and wrap this up so that we can come back on the 22nd and keep this within a, I don't know about y'all, but sometimes there are places that give me excellent information, but if I am sitting and getting for more than 45 or 50 minutes, I'm done. And whatever it is after that point, it doesn't matter how good the information is, it's not sinking in. So we do want to try to keep these relatively short for those families who may need to watch and still get to it. So thank you all very much. And please hold on to the line so that we can make plans for the 22nd. For everybody else who is watching, thank you so much for joining us. Please fill out the evaluation that will be attached. It's in the description field of the YouTube channel. We will also put up we'll add the links to the Check Lifeline for the National Verificator. I like Verificator better, but it's really the National Verifier, along with where you can find a list of carriers. So we'll make sure that we get those links posted as well. And then next time, we're focusing in on TEPP and the equipment that may help people with disabilities. And then that larger question with Becca about, well, if I am eligible for this, what other programs might be out there that I might be interested in? I think that's an important conversation as well. I'm looking forward to having us all back on the 22nd. Thank you. This has been so much fun. I just really like you guys. So we'll have you back the 22nd, and then we'll make this like a monthly occurrence. No, but I really do like talking to you all. So thanks for being here. I'm going to stop the recording and then talk a little bit more with you. Thank you so much. I hope everybody has a fantastic time.